learning the foundations of medicine can feel overwhelming. Where do I even begin? McGraw-Hill's Access gives me the tools I need to build a strong foothold, all in one place. Access provides essential textbooks like The Big Picture, Gross Anatomy, giving me clear, concise overviews. I can also access core texts like Ganong's Medical Physiology Examination and Board Review, Pathology, a modern case study, and Harper's Illustrated Biochemistry, reinforcing foundational concepts across all my courses. Access brings complex topics to life. While studying the cardiovascular system, the heart anatomy section shows its relationship to other thoracic structures, giving me crucial context. Interactive diagrams and animations let me explore chambers, valves, and blood flow in detail, along with videos that demonstrate heart function dynamically. Such variety of content allows me to expand and solidify my understanding of the cardiovascular system. Access connects textbook knowledge to clinical practice. Cases on heart conditions walk me through diagnosis and the pathophysiology, biochemical, microbiological, and pharmacological principles, building a bridge between my medical theoretical knowledge and clinical practice. Plus, I can easily search for specific topics and use tags and favourites to organise all my materials. With Access, I feel more confident tackling medical school. It's the resource I need to build a strong foundation.
Clinical rotations are demanding. Take cardiology, for example. Heart failure patients present with complex symptoms, and I need to be ready. With Access, I get quick, reliable information at my fingertips. Quick medical diagnosis and treatment gives me concise guidance on heart failure when I need it most. A patient just came in with shortness of breath and edema, HFrEF or HFpEF or another type. Access helps me quickly review the diagnostic criteria. Access also offers in-depth cases on various cardiovascular presentations, providing the nuanced outlook necessary to reach the right conclusion. These cases walk me through diagnosis, pathophysiology, and tailored plans of management. I'm concerned about choosing the right drug. The drug database is comprehensive, giving me all the info I need on dosages and interactions. And when I need to brush up on clinical skills, Access has tailored resources such as abnormal heart sound audios due to valvular dysfunction, S3 and S4. I have access to clear patient education handouts on heart failure, helping me communicate effectively and confidently with patients. With Access, I feel confident dealing with complex heart failure cases. It's the resource I rely on to bridge the gap between my textbook knowledge and real-world patient care. Exams are approaching, and while I feel like I know some of the material, how can I be sure I'm fully prepared? McGraw-Hill's Access is my go-to resource for effective exam prep. Access helps me pinpoint my weak spots, and when I really want to test my knowledge, Access provides extensive question banks from reputable resources like Harrison's Review Questions and Katsung and Trevor's Pharmacology. These questions mirror the style and difficulty of the actual exams. I can generate custom multiple-choice quizzes from a range of resources, covering both basic and clinical sciences. This targeted practice lets me identify exactly where I need to focus. Interactive flashcards are perfect for memorizing, comprehending, and applying important details across various medical subjects, from biochemistry and microbiology to pathology, pharmacology, and physiology. With Access, I can confidently identify my knowledge gaps, study efficiently, and walk into the exam room feeling prepared and in control. Plus, the Access app lets me study anytime, anywhere, even on the go. It's the all-in-one resource I need to succeed.